Let's return to our earlier story on COVID-19. The World Health Organization has said that 29 people die every hour on the continent. We're also learning of a new variant, C12. But the good news is that the Ghana Health Service has received some equipment that will help them in sequencing. Let's find out why this is important. We're joined by a virologist at the KCCR, Dr. Michael Owusu. Doc, thank you so much for your time here on Joy News Prime. First, help us understand why it's important to know the changes that the virus makes, or the how the virus mutates, like you said. Why is this important as far as managing the pandemic is concerned?
Okay, good evening to you, and good evening to all your viewers. Coronavirus is a unique virus which has about 30,000 base pairs. What it means is that it is arranged in form of blocks. And what we know about the virus is that every time that the virus reproduces or recombines, at least you expect that one block will be removed and be replaced by another block. And this goes on through the lifespan of the virus. So for every month, every 2 months, every 3 months, these changes occur. And the longer the virus, the higher the tendency for the virus to undergo through these changes. So one of the things you do as a way of, as a public of action or implementing interventions is to be able to follow through the changing dynamism of the virus. Anytime the virus changes, there are things it does. It will be able to affect your antiviral drug therapies. Okay. It can affect the vaccines that are given out. It can also even have a clinical picture what is unique. It could cause more severe disease or could cause more deaths. Sometimes even the detection techniques that we use in the lab for diagnosis can also be affected. So if you don't track the virus to know what changes it goes through, it is difficult to be able to put in any interventions that will be able to help curb the spread or possibly eradicate the virus from the country. This is why genomic surveillance becomes very important, and therefore sequencing is very crucial when it comes to dealing with viruses like coronaviruses.
But when you're seeing such irregular emergence of variants, how differently does it impact the situation?
Well, this is why since COVID started, from the earlier original strain from Wuhan, we knew the clinical picture, we knew the level of transmissibility, we understood the reproductive number of the virus. But the virus also wants to survive, so it has to go through a next level of mutation. And when it went through that and gave us this alpha variant, the reproductive number increased, transmissibility was high, severity of disease was high. And then we came back to now Delta, which is almost 3-4 times much stronger than the Alpha. Yeah. And also able to cause more sickness and can cause more death. So the mutation is a way for the virus to be able to adapt to the human population and to survive. And it survives by killing and by causing more destruction. So this is how, the viruses behave, which is why we have to know what it does. So we'll be able to have drugs, have vaccines, have diagnostic techniques to be able to target this virus.
And we know that in South Africa now, there's a discovery of a new strain. It's thought to be deadlier than the Delta, which is already causing a lot of trouble here in Ghana. We know that it's leading the spread now. What do we do about this new strain?
Well, one of the things that many countries are doing to, if possible, prevent these strains from getting to their countries to vaccinate. Most of the vaccines in the system are highly effective against even new variants that will emerge. So once you take the vaccine, you have some level of immunity to the point that at least if the virus has to evolve, you'll be able to control it. So the more countries lag behind in vaccination, the higher chance, or the more opportunity we give for the virus to run through and undergo mutation. So it's a goal what we call selective pressure. So if you're able to vaccinate more, you are able to put pressure on the virus to stay as it is. But if you don't vaccinate more, you give it the opportunity to go through. So I'm not surprised South Africa has recorded one, and I will not be surprised if other countries begin to see a new form of the Delta. After Delta, we should have another stronger one that will be even more deadly than the Delta, that will try to evade through the population and cause more destruction. So until we are able to close in on the virus with vaccination, it will be difficult to stop the virus from mutating. It will be very, very difficult.
Will border control make any difference in the way that we manage this to prevent at least its entry into the country? Will that do anything?
Well, it depends on the level of capacity of the country. This is what is very unique. I mean, if the country is well prepared and have what it takes to conduct rapid test and surveillance at the borders and to ensure that if cases come in, they are picked quickly and people are managed quickly, it shouldn't be a problem to open the borders. But if you don't put in the necessary measures to be able to manage it, then of course you have the potential of having cases run through. But talking of the borders in Ghana, it's not just about COVID. I mean, most of the COVID cases are imported through the airlines, but there are threats of some hemorrhagic fever viruses, including Marburg. We've heard about this, including possible Ebola, and others that is quite unclear how they are going through the West African population and what they are doing. It's just not too clear for us to know. So immediately, if you have the structures to be able to detect quickly and to be able to rapidly move in and screen and isolate people who come in, then you can open up and deal with the population that come in. But then if the structures are now being set up, then it will be very good and prudent to have them well installed, well set up. And for me, as a virologist, you want to look at having container labs well positioned at the borders so that in case people come in, they can be screened quickly and be tested quickly so that you'll be able to at least prevent as much as possible some cases, even if not COVID, some other hemorrhagic fever virus people who may be incubating the viruses from coming in. So the capacity of the country comes into play when it comes to the decision to either open or not to open. And this is what I think should guide us in doing this.
Thank you very much for your time. That's Dr. Michael Owusu, a virologist at the Kumasi Center for Collaborative Research.